Welcome to AFSPA Talks, a production of the American Foreign Service Protective Association. Each month, we deliver informative health and wellness topics you want to know about, so make sure to subscribe to us on your preferred podcast platform. And if you have any questions about content discussed in this episode, ask them at AFSPA Live, our live Q&A session streaming every last Thursday of the month at 11 a.m. Eastern Time on youtube.com/AFSPA Cares. Now here's your host, Chief Executive Officer Kyle Longton.
Hi, and welcome to another episode of AFSPA Talks. I'm Kyle Longton, and with me as always is...
Maddie Norton.
Maddie, it's March.
It is. It's Medicare March.
And sometimes Medicare can drive us to madness. That's not usually what we think about when we talk about March Madness, but it is
Right.
Medicare March. And so we actually... We'll talk a little bit more about today's episode, but this is a complex issue. And the thing is that it comes for us all one
Yes.
day, at least for us. I hope it will.
Me
I hope
too.
it'll still be an option then. But for those who are approaching Medicare eligibility or already in it, you've got the option now. You got a lot of options. But before we get into that, I want to note, yes, it's Medicare March. But we have an AFSPA Live coming up. And Manny, what's the date for that?
AFSPA Live will be on March 27th, Thursday at 11 a.m. Eastern Time.
All right. And our topic is not about Medicare this month, but it is focused on issues that might be of interest to the Medicare eligible population. I wonder if you could talk a little bit more about the topic.
Yeah, we're going to be discussing senior planning with a life insurance specialist, Nicole. And we have a form up that you can submit your questions to, because I know that there might be a lot of questions, especially about those thinking about retirement or, how to go into it or, what plans to do, things like that. So definitely tune into that and ask all of your questions about senior planning.
Yeah, and that's just this month. We continue to have a lot of events throughout every month. And Maddie, we were just talking before we started recording about some of the other topics that are coming up from some of our partners, actually. And can you give us a little preview of what's ahead?
Yeah, so we are still keeping up with our Prudential webinar series that is offered free to AFSPA members. You can find all of our links on that on our events page, afspa.org/events. But to give you a little preview for April, this is on April 1st. We're going to do a webinar about taking control of your taxes. For June, we'll be discussing, or a Prudential webinar will be about healthcare and retirement, where they will be discussing the ABCs of Medicare. So that ties into our theme just 3 months later.
Yep. And we are actually working with Prudential to make sure that these scheduled webinars, and we may be adding some others with Prudential or other partners to make sure that we are addressing changes that are coming and topics that are of importance to the federal workforce, to the retiree population as well, because I don't have to tell you all, there are a lot of changes happening right now. And so we're doing our best to pivot and make sure that we're getting information in front of you that may be helpful as you may be facing decisions you weren't anticipating. And I'm going to use that to pivot back to our topic for this month, which is Medicare. And one of the things that I do is teach a class through the Foreign Service Institute for their retirement planning seminar on Medicare and the Federal Employee Health Benefits Program. Not specific to the Foreign Service Benefit Plan, but certainly applicable to that. But normally we have 6 classes a year. Maybe we've got these are people who are planning years out. In some cases, or sometimes there are people in those classes who are like, yep, Friday's my last day
Right.
of that week. I'm usually offering the class on a Monday. And that's great. But I did hear some statistics this past week specific to the Department of State that so far through mid-March of this year, 700 people have retired from the Department of State. Whereas in all of calendar year 2024, there were only about 800 total retirements. So we are seeing this coming. We are seeing people retiring at a younger age. And so they're hearing about Medicare, they're thinking about it, and then the decision's maybe 10 years out. And so we're trying to provide continuing resources to our members. And updates on what's happening, because Medicare does change usually not significantly, although 2025 did see some significant changes, but usually not that significantly. We are trying to provide that information, and that's today's podcast actually,
Yep.
which is a recording of the same class I was just talking about, the Medicare and the FEHB, putting it together. So it is, Manny, back to what you said, it is an overview of the ABCs of Medicare.
Yep.
It's an overview of out-of-pocket costs, premium costs with each of those, considerations when it comes to your income, and then specifically dives into a little bit about the three different types of providers in Medicare, and then finally how Medicare and FEHB work together. And then as a last little bit, if you decide not to get Medicare Part B and just keep your FEHB, what does that coverage look like in retirement? So listen, that we got the recording today, but I got to tell you, it's better in video format. So you can take this with you, listen to it. It's better in video format. And Manny, you posted that video actually earlier this month. Where can people access that?
Right. So this video is on our YouTube channel, which is AFSPA Cares. That's what you can type into the search bar. It'll pull up, and you will see the video, and it's titled Medicare and the FEHB, Putting It Together. And it's the 2025 version because you may see that Kyle has done a 2024 and a 2023, maybe even a 2022. I can't remember. But if you want to get the latest updates about Medicare, that is the video to watch. And it's longer than most of our podcasts, but that's
Hmm.
great because I know that you cover almost every question possible about Medicare.
Yeah.
And especially if you recently attended our annual meeting and maybe you had some more questions, that's definitely where you should go to check it out. So AFSPA Cares on YouTube, that's our channel name, and it'll be our second latest updated video, or most recent video, because
What,
this podcast will be the first.
and out of curiosity, the annual meeting, you mentioned that was held on
Yes,
March 7th.
it
If
was.
people want to get some more information about that, if they missed it, is that available or will it be available soon?
It will be available soon, so keep a lookout on the same YouTube channel.
Oh,
And I know we try to
maybe
keep
just
it simple.
subscribe.
Yep, just subscribe if you will, and then you'll get a notification that we have posted it. So definitely look out for that. We're making sure it's edited and that everything looks good for you guys so that you can see it if you were there and watch it again, or if you weren't, to see what we all talked about. So definitely be on the lookout for that.
Fantastic. So with and I will tell you that this podcast is just me talking. There's not back and forth. There's no special guest. It's just me talking. So the video does have slides. It does have the
Yes.
information I'm talking about. So that might be the better way to go. But otherwise, take this with you. Go back and watch the video with the slides you're interested in. And at the end on the slides, there is a contact page. So if you do have
Yes.
questions now or in the future, reach out and we'll get you answers to those questions. Even if you're not enrolled in Foreign Service Benefit Plan, though we hope you are. But
Yes.
if you're not enrolled, we're happy to answer those questions to our best to ability, based on your current enrollment or other options for the future. So enjoy today's episode by video or recording, and we'll be
Yep.
back with more in your feed next month.
Absolutely. All right. Let's get started.
Hello, my name is Kyle Longton. I'm the CEO of the American Foreign Service Protective Association. I am privileged to have the opportunity to speak several times a year to a retirement planning seminar class at the Foreign Service Institute. While hundreds attend this class every year, many others don't have access to it or find themselves with questions outside of the timing of the class. For all of you, this video can serve as a resource when you have questions or when you're trying to make plans for the future. The video lasts about 45 minutes and the information is accurate as of the recording date, which is March 4th, 2025. There may be changes throughout the year, and if there are significant changes, we will take this video down and record a replacement. At the end of the video, you will find an email address, presentation@afspa.org, and you should feel free to contact me and my colleagues at that address. We will be happy to answer questions you have, whether you're an AFSPA member, enrolled in one of our programs, or not. We're here as a resource and as subject matter experts for the entire federal workforce. So without any further ado, let's talk about Medicare and the FEHB and putting it together. All right, so as I said before, this information in this presentation is accurate as of the recording date of March 4th, 2025. Let's dive in. And I want to start with a couple disclosures. So this is intended for informational purposes only. We're talking about two programs here with the Federal Employee Health Benefits Program and Medicare. Both of these programs have a lot of regulations around them, and sometimes those regulations can change. I encourage you review your FEHB plan brochure. Your plan publishes one every year. There are searchable PDF copies on the plan's website and elsewhere. Utilize those when you have questions. And if you're not sure where to start, turn to section 9 of the brochure. That is where you'll find information on coordinating coverage with other plans. Additionally, you should review Medicare information material. You will receive, once you become eligible for Medicare, you will receive a brochure annually about Medicare and Me that will provide some examples and an overview. It's almost as long as your FEHB brochure, but has some really great information in there. That also is available online on the Medicare site. I also want to stress that the information in this presentation applies only to federal employees and annuitants who are covered under the Federal Employee Health Benefits Program. It is not applicable to individuals without the FEHB. It is not applicable to Postal Service employees and annuitants. Postal Service employees and annuitants have their own health benefits program as of January 1st, 2025, and it has different rules. So I also want to encourage you, as you're looking at your plan materials, make sure you're looking at the FEHB plan rather than the Postal Service Health Benefits Plan brochure, because some carriers offer plans in both programs, and the rules do differ. Big difference there is that FEHB beneficiaries do not have to take Medicare Part B, whereas Postal Service beneficiaries do have to take Medicare Part B with very limited exceptions for the Postal Service program. So everything today that I'm presenting is geared toward the folks who are covered by the Federal Employee Health Benefits Program. It is also not applicable to those who are in the private sector. There's a few acronyms that will appear on the slides or may come as part of the discussion today. The first you've already heard multiple times, which is FEHB, and that is the Federal Employee Health Benefits Program. This is the group health insurance program for civilian employees of the executive branch. And you likely are familiar with this, whether or not you've heard this acronym before. You'll also hear FFS, or at least see that sometimes in the slides. That stands for fee for service, which is different from HMO, which are the health maintenance organizations. These are sort of the two main types of health plans that are offered within the FEHB. You'll see OOP for out of pocket. That means the money that you're paying for your care. And OPM, which is the Office of Personnel Management. For most people who are watching this presentation, the biggest question will be, should I enroll in Part B? And we're going to attempt to give you the tools and the information, the resources to answer that question on your own, because it's going to be a different answer for each person. It depends on income, it depends on your risk tolerance, it depends on your medical history, it depends on where you're going to live. And that brings me to the first answer to the question, which is, are you going to be spending a lot of time overseas? Because guess what? Medicare does not cover care received outside the US except in extremely limited situations. I'm talking about, maybe 2 paragraphs worth of information that where there's actual coverage provided under Medicare. So generally, your FEHB plan, your fee-for-service plan, will be the primary payer for services you receive outside the 50 United States. If you receive care overseas, you will still have to file a claim with your plan, even if you have Medicare A and B, because there just won't be coverage. So a big question for some of you may be, are you going to spend a lot of time overseas, and are you going to be receiving your medical care overseas? Because if the answer is yes, then Medicare Part B may not be right for you because you might be paying for coverage that you would never actually be able to take advantage of the benefits. So that's one thing to keep in mind. Now, some of you, that may have been the answer to your question, and that's the end of things for you. But for most people, we've got a little bit of ground to cover. I've got three main sections of the presentation. The first is an overview of Medicare, all the parts A, B, C, and D, the premium costs for those, the out-of-pocket costs, and the different provider types. And I'm going to cover that all in a general way. That information pretty much anybody could benefit from knowing. But it's when we get into sections 2 and 3, we talk about how the Medicare coverage works with the FEHB, or it becomes very specific to the federal population and how benefits are coordinated. So we'll once we get done with the overview of Medicare, we'll talk about Medicare coverage and the FEHB, how they work together. And then finally, if you decide not to take Medicare but retain your FEHB coverage, what does that coverage look like? And we're going to cover all of that today, as well as provide you with some resources. So let's dive in. Medicare has 4 parts. Original Medicare is parts A and B. And Part A is essentially hospital insurance. It is free. There is no premium cost for most people. You've been paying into this throughout your working career. But this covers the services you receive in the hospital, like the room and board, maybe the surgical theater, and things like that. The professional services, and pretty much most of what we think of as healthcare, doctor's visits, labs, imaging, things like that, are covered under Part B. That's medical insurance. We'll get into some examples in just a few minutes. Part B does have a premium, and it starts at $185 per month in 2025. Every year, they adjust the premiums. And your premium can be affected by your modified adjusted gross income from 2 years ago. It's a means testing, so the premium can vary, and I've got the chart on that coming up in a few minutes, and we'll talk about exactly how that works. Part C is often known as Medicare Advantage. This is comprehensive coverage. So yeah, you have to have Medicare A and B to elect a Medicare Advantage plan. And you do have to pay your Part B premiums. And oftentimes with Part C, there may be additional premiums, but there may be additional benefits included in those Medicare Advantage plans as well. Finally, Part D is the youngest of the Medicare parts, although it's approaching its 20th anniversary, and this is prescription drug coverage. And the premiums for the Part D plans do vary by plan, and there is means testing applied to Part D plans as well, and I've got that chart to show you in just a minute. So again, for Medicare Part A, this is inpatient coverage. This is hospital coverage. So when you are actually admitted to the hospital for inpatient care. Now, some folks may think that they are admitted to the hospital for inpatient care, and you're in a room, maybe it's even a private room, you're receiving meals, they're coming in to check your vitals every few hours, you're even getting prescriptions from the hospital pharmacy. But if you came in perhaps through the emergency room, you may only be in the hospital for observation care. And observation care can last up to 48 hours under many health plans and for many hospitals. That is not covered by Part A. That is covered by Part B. So that's an important distinction to understand exactly how you are being treated in that hospital stay. Part A also covers hospice care services. And there's also coverage for limited inpatient care in a skilled nursing facility. Now, this does not cover custodial or long-term care. This is while you might be in a skilled nursing facility receiving skilled nursing care. And most people in a what we would typically think of as a nursing home or even a long-term care facility are not receiving skilled care. So this is a limited benefit. Everyone who's eligible for premium-free Part A, which is most people, should enroll when they become eligible at age 65, even if you're still working, because it doesn't cost you anything, and it has the potential to save you money in the event of an inpatient hospitalization. So I encourage you, consider that when you hit your 65th birthday. We'll talk about how to enroll and the time period for doing so a little bit later. I mentioned before that Part B Provides coverage for most of what we think of as medical care. It's your doctor's services and tests. It includes outpatient hospital services, including that observation care that I talked about before. There's coverage for limited home health services, but in this case, you must be certified homebound by a physician, and so there are some limitations on that. Part B also covers durable medical equipment, kidney dialysis services, and certain preventive and screening services. There is not coverage for an annual physical exam under Medicare Part B, but there is sort of an annual wellness check with your doctor. Enrollment in Part B is voluntary and it begins at age 65. There is a monthly premium, and you may be faced with a penalty if you do not enroll at your first opportunity and decide to enroll at a later date. But there are certain situations under which you can defer your decision on Part B without a penalty. And one of those is if you are employed and covered on a group health plan based on current employment. Now, that could be your group health plan that's tied to current employment, or if you're covered under your spouse and your spouse is receiving group health insurance through current employment, that could also help delay that Part B. I've got some more information on that in just a couple slides. But before we get to that, I want to talk about the cost of Medicare Part B, because this can be a deciding factor for many people. Part B premium for each person, and it is an individual premium, is means tested based on your modified adjusted gross income from 2 years earlier. You may pay what is known as an income-related monthly adjustment amount, or an IRMA. So what could that mean? This. So these are the premiums for 2025, and the premiums change each year. And every year they go back and look at your income tax returns from 2 years prior. So this lists the income bands based on your modified adjusted gross income in 2023 for individual filers and for those who are married and filing jointly. Now, for some people, you may be have been earning more 2 years ago than you are now because perhaps you've retired or something else. There's information about that in the publication that's linked at the bottom of the screen. This is Medicare Premiums Rules for High Income Beneficiaries, and you can see the link to that information there. And for some people, this may look like a lot of money, especially right off the bat. Maybe you've just recently retired, you had a much higher income when you were actively working versus now that you're retired. And so for a year or two, it may mean higher monthly premiums, but after that, it may actually decrease some. Now, there are a number of ways and reasons that you can request what's known as a redetermination of your premium. Some of those are listed here. For instance, if you get married, if you get divorced, or if you are widowed, if you or your spouse stopped working, retired, or if you reduced your work hours, and also if there's more recent tax information that's available. So again, this would be based on 2025 premiums would be based on your modified adjusted gross income from 2023. However, when you reach this, perhaps you've got your 2024 income tax information ready, and that shows a difference and may mean a lower premium. You can submit that as well. But you should call the Social Security Administration at the number there on the screen and review the publication Medicare Premiums Rules for High Income Beneficiaries. Now back to our four parts of Medicare. Medicare Part C, these Medicare Advantage plans, likely have heard about them. You've seen them on TV. You may have received flyers about them. You may get regular phone calls about them. And these are incredibly popular in the United States. More than half of people who are eligible for Medicare are enrolled in Medicare Advantage plans. They've got advantages, and for some people, they're the right fit, and for some people, they may not be. They do offer comprehensive type options, and these plans have been approved by Medicare. It's not just anybody can offer these. They do have to go through a review process with Medicare. And under these plans, those who are enrolled may receive additional benefits such as vision coverage, dental coverage, podiatry, even hearing aids, things like that. And they may also have a lower cost sharing, lower out-of-pocket costs than you would have with original Medicare. You do have your Part A and Part B coverage, but it's not from original Medicare. It's tied up in this Medicare Advantage plan. And so you may find that there are different out-of-pocket costs and different rules apply. For instance, with Medicare Advantage plans, there may be a requirement for pre-certification or prior approval before an inpatient hospitalization or a particular type of surgery that original Medicare may not require that prior approvals. Just one example. If you are enrolled in a Medicare Advantage plan, a commercial Medicare Advantage plan, you have that coverage and you have your FEHB coverage, your FEHB plan will not waive your calendar year deductible, your coinsurance, and so forth for care that's received outside the Medicare Advantage service area. What does that mean? Well, most Medicare Advantage plans function like an HMO, which means they provide coverage only in a specific geographic region. If you go outside that geographic region, you may have limited coverage for an accidental injury or a medical emergency, for instance, but not for comprehensive care in any way. You'd need to receive that within the network, within the Medicare Advantage service area. So your FEHB plan, if you would still provide coverage, but they won't waive deductible coinsurance. They won't waive your out-of-pocket costs under the FEHB plan for if you are enrolled in a Medicare Advantage plan in the commercial area. We'll talk about some of these new Medicare Advantage plans that are within the FEHB structure a little bit later. This is getting more and more complicated, and I'm hoping that you'll walk away a little less confused once this presentation is over. I also want to note that if you do enroll in a Medicare Advantage plan, a commercial Medicare Advantage plan outside the FEHB structure, you can suspend your FEHB coverage. You want to make sure you suspend that. There's a special process for it. You don't want to terminate your coverage because if you terminate your FEHB coverage, you cannot come back to it in the future. By suspending it, you do have the option of returning to the FEHB program during a future open season or other qualifying life event. Finally, Medicare Part D provides prescription drug coverage. Now, the premium costs for this can vary by plan. Most people enrolling in a commercial Medicare Part D plan will pay both a monthly premium, and again, the means adjusted gross income, the means testing applies, and we'll see that in just a moment. They'll also be subject to a deductible, copays, and coinsurance. There's been a lot of changes to Medicare Part D starting in 2025 and even more coming. We'll talk about those toward the end of the presentation, at least as they are in place as of today. Now, all FEHB plans offer what's known as creditable coverage for Part D plans. What does that mean? Go to your trusty FEHB brochure, and on the inside front cover, there's a statement about what creditable coverage means. And this basically means that your FEHB plan provides prescription coverage that is equal to or better than the required minimum Medicare Part D coverage. So if you decide to enroll in a commercial Part D plan at some point in the future, you should not face a penalty for late enrollment because you've had other coverage. That does not apply to Part B. It applies to Part D as in drug. But per OPM, and this is their statement, federal retirees likely will not benefit from enrolling in a Medicare Part D plan outside of their FEHB coverage and paying extra for prescription drug benefits. Like the Part C plans, some of the FEHB plans are now offering their own Medicare prescription drug plans within the FEHB structure, and we'll talk about those a little bit later and why they may be a good option for you. As I mentioned before, Part D premiums are subject to means testing for the modified adjusted gross income. The income bands here are the same as we saw before for individual and for married filing jointly. But you can see that the IRMA, the income-related monthly adjustment amount for Part D, is significantly less than you would see for Part B plans. Now, if you're in the commercial space, there's going to be a set premium for your Part D plan, and then the amounts you see would be added to that based on your income. We'll talk about how this functions in the FEHB space a little bit later. The main window for most people to sign up for Medicare is the 7 months around their 65th birthday. So you have 3 months prior to your birth month, and 3 months after your birth month. Everybody who's eligible for premium-free Part A should enroll at age 65. If for some reason you miss that enrollment period, you can enroll later during the general enrollment period, which occurs annually between January and March. But please be aware that for Part B, as I mentioned earlier, there can be a late penalty, but I didn't tell you what the penalty was. And so the penalty is in place for as long as you have Medicare, and it is equal to 10% additional premium for each full 12-month period that you didn't sign up and could have. So let's say you're retired at age 64, your 65th birthday comes around, you for whatever reason don't enroll in Part B, you wait 2 years, at age 67 you decide that actually I would like to have Part B, so you go through the process to apply during the general enrollment period. At that point, there's been two full 12-month periods, 2 years, that you could have had Part B and didn't. um, that's going to be a 20% penalty on top of your premium for as long as you have Medicare. So getting the timing right on Medicare is important. Now, there are some people, as we mentioned before, that could be eligible for what's known as a special enrollment period. And this particularly applies to those who are still receiving their group health insurance as the result of current employment when they reach their 65th birthday. So if you are still working until age 66, you can delay that decision on enrolling in Medicare Part B until you retire. Or if you're covered under your spouse's group health insurance, let's say that maybe you're older than your spouse, or and so you are retired, but you're covered as the dependent on your spouse's health insurance, and your spouse keeps working until you're 68. Your spouse then retires, loses their coverage as part of current employment. Maybe they continue, or you continue to have coverage through a retiree health plan. That doesn't count as current employment. Even if it's your FEHB plan and your benefits haven't changed, if you're receiving that as a result of retiree benefits rather than active employment benefits, that's the key piece. But let's say, go back to that scenario, you keep working until you're 66, or you're covered under your spouse and they don't retire until you're age 68. In that case, you can delay your decision until your retirement or your spouse's retirement, and make the decision about Part B at that time without a penalty. You will, from the date that you lose your health insurance from current employment, starts an 8-month period that you can decide to enroll in Part B without a penalty. But you've got to turn an extra form in. So you've got two forms that you'll have to submit at that point. One is the CMS 40B. This is just the application for Medicare Part B. The other is the CMS L564, and this is proof of current employment coverage. This has to be signed by the employer. You may be able to submit this to your retirement counselor, to your HR office. There may be a number of folks who can fill this out, but it basically confirms that you've had group health coverage until the date of retirement that was the result of current employment. Do start on this early. Don't leave this to the last minute, and ask your HR office or your retirement counselor to complete this shortly before the retirement date. You may even want to give them a month or two. The other thing I want to encourage you to do is that you should notify your FEHB plan when you enroll in Part A, and if you enroll in Part B. Let them know, send them or call in with your Medicare beneficiary number when you get your Medicare card. And that way they can make sure that they're coordinating benefits correctly with Medicare. Because sometimes it can take a little bit of time for that information to come from Medicare to the plan. There are some behind the scenes processes that happen, but go ahead and let them know the effective date when you enrolled and so forth, so that they can make sure you're getting the most out of all of your coverage. We talked about when you can sign up. Here's the how. Um, the most frequent way people sign up for Medicare now, and probably the easiest, is to go online. You can go to the website there through the Social Security Administration. There's also information on Medicare's website, and enroll that way. It takes about 20 minutes, certainly less than half an hour, to do some of the basics. They do have a specific login procedure now that requires multi-factor authentication. You can call by phone if you prefer that. You can even go in person, but I would encourage you to call your local office. If you're outside the US, the nearest office to you, which may be at the embassy or consulate, um, and make an appointment if you prefer to go in person. They are seeing people in person, but they may have more limited staff these days and may not be able to see you without an appointment. So make sure you set that up. All right, I promised we'd also talk about some of the out-of-pocket costs for Part A. Now, I'm giving you the basic information about the out-of-pocket costs. A little bit later, we'll talk about what FEHB plans cover in terms of these out-of-pocket costs. So this is just what you face for having Medicare Part A and Part B, does not discuss the coordination of those benefits with your FEHB plan. So when it comes to Medicare Part A, you have a hospital deductible of $1,676 for inpatient days 1 through 60 of each benefit period. Um, if you are inpatient longer than that, there's an additional $419 daily copay for days 61 through 90. And if for some reason in the course of a year, you are inpatient for more than 90 days, you would be going into what's known as your lifetime reserve. And there would be an additional $838 daily copay for each day over day 90. If you are at a skilled nursing facility receiving skilled nursing care, and this may be perhaps you had surgery and you've gone to a rehab center and you're receiving therapies every single day, medical supervision, things like that. This is usually a limited amount of time. For a skilled nursing facility, the first 20 days covered by Part A. After that, there is a daily copay of $209.50 for days 21 through 100. That only applies as long as you're receiving skilled care. And it's not the usual, it's not what we usually see for people to be receiving skilled care for over 100 days. So just be aware of this. Keep an eye on that. Make sure you understand your coverage. Part B, fewer bullet points here. It's a little more straightforward. You have an annual deductible of $257. And then for most procedures, there's a 20% coinsurance. Medicare will cover 80%. You're responsible for 20%. However, there are what are known as non-participating physicians who may bill extra. Now, most cases, your FEHB plan is going to cover those out-of-pocket costs with Part A. They're also going to cover that yearly deductible and the 20% coinsurance for Part B. But there's a number of different types of physicians within Medicare, and how they work with Medicare and how your FEHB plan covers that cost sharing can vary. So let's talk about physicians. There are three main types. The first are usually the most prevalent that you'll find, although the second may be what you run into as well. So the information here assumes that you are retired, receiving your group health insurance as a result of a retirement benefit through the FEHB, that you're over age 65, and that you're enrolled in a fee-for-service plan, and that you're also enrolled in Medicare Part B, which would then serve as your primary payer. In this first group of providers, the provider accepts assignment, or they're known as a participating provider with Medicare. What does that mean? That means they agree to be paid by Medicare. They accept the amount that Medicare approves for their services, which may be less than they negotiate with other health insurance plans, or that somebody would pay coming in without any insurance. And they will only charge the Medicare deductible and or the co-insurance amount, whatever may apply. In this case, your FEHB fee-for-service plan will cover the cost sharing. You're not going to be out of pocket for the Medicare deductible or the co-insurance, that 20%. The second category of provider are those who do not accept assignment, or they're known as non-participating providers. These physicians can charge more than the Medicare approved amount, but there's a limit to that. It's literally called the limiting charge, which is usually about 15% more than the Medicare approved amount. All FEHB plans will cover the regular cost sharing. You may be responsible for that extra 15%, though some FEHB plans will cover the cost sharing up to the limiting charge. In just a moment, I'm going to show you these examples with some numbers. The final category are known as private contract providers or opt-out providers. These providers will ask you to sign a written agreement between you and the doctor not to bill Medicare. That means the doctor's not going to bill Medicare and you can't bill Medicare. Can't bill original Medicare, you can't bill a Medigap plan, any kind of Medicare Advantage plan, anything like that. None of those will pay. You are ultimately responsible for all the charges. And you cannot be asked to sign this in an emergency. Now you're thinking, okay, but I've still got my FEHB plan. It's a fee-for-service plan. What's that going to cover? Well, in this case, for these opt-out providers, an FEHB plan will not pay more than they would have paid if Medicare had made their payment, which is basically 20% of the Medicare approved amount. This is a federal regulation. This does not vary by plan. So let's look at some numbers. All right, so for the first group of providers, those who accept assignment, those who are participating with Medicare, let's say that the doctor usually bills $1,000 for whatever service you receive. Medicare says we're only going to pay $800. The doctor said, that's fine. I'll accept $800 for Medicare beneficiaries. Medicare is going to pay 80% of that, or $640. Your FEHB plan is going to cover the other 20%, and you pay nothing. $0 out of pocket. For the second group of providers, these are those who do not accept assignment or who are what are known as non-participating. Again, they typically bill $1,000. Medicare is still saying, look, we're only going to pay $800. That's our Medicare approved amount. They say, I want a little bit more than that. I'm going to charge up to the Medicare limiting charge, 115% of the amount, or $920. Medicare is still only going to pay 80% of their approved amount, or $640. Your FEHB plan is going to pay 20% of that Medicare approved amount, still same $160. You could be responsible for $120. Some FEHB plans will cover that additional $120, but it varies from plan to plan. So check your plan's brochure, call them, find out what they will cover. Again, refer to Section 9 of that FEHB plan brochure. The final category of providers are those that are private contract or the opt-out providers. Now, they also, in this case, charge $1,000. They're going to get $1,000. They don't care about the Medicare approved amount of $800. They are still going to get $1,000. Medicare is not going to pay anything. Your FEHB plan can only pay what they would have if Medicare had made a payment, which is to say that $160 again. That means that you, as the patient, are responsible for $840. And I share this for two reasons. One is if you decide that Medicare Part B is right for you, then be careful when you're selecting providers. Ask them how they work with Medicare. If they're an opt-out or a private contract provider, they may not be right for you. The other reason is if you're already seeing a doctor and you really like this doctor, you want to continue seeing them, and they are an opt-out provider, that may not be right. Medicare Part B may not be right for you because you could end up paying more in both Medicare Part B premiums and your out-of-pocket costs if you decide to enroll in Part B and continue to see this provider. So take a look at this. Make sure it makes sense for you. I've talked to someone recently who has a doctor they love. The doctor switched to a concierge style of medicine, and they also went private contract with Medicare. And this member was enrolled in Part B, still paying their Part B premiums, but they weren't getting any benefits for going to see this doctor anymore from Part B. They were paying more out of pocket than they were before. So in that case, they decided not to continue with Part B. You may prefer to continue with Part B and just find a different provider. It's gonna be an individual decision for each person. These are just some factors to consider. All right, so let's talk about how Medicare and the FEHB work together in a little bit more detail. So these slides, this slide, I should say, assumes that once again you are retired and receiving your group health insurance, your FEHB coverage as a result of a retirement benefit. You're over age 65. You are enrolled in an FEHB fee-for-service plan, and you're enrolled in Medicare A and B, which means that Medicare is the primary payer. Your FEHB plan pays secondary. Your FEHB plan is going to fill most of the gaps in Medicare for services covered by them. have a little note here about the skilled nursing facility limits. Some people, and I've run into this before, where they said, okay, I exhausted my Medicare benefits for skilled nursing facility. Now I'm going to use my FEHB benefits for skilled nursing facility. No, it's they start day one for both benefits is the same day. They run concurrently. So just be aware of that. Now, some plans will waive costs like the deductible, their medical coinsurance and copay as an encouragement to get you to enroll in Medicare Part B. All the plans are going to coordinate benefits with Medicare to help you get the most out of your coverages. And generally speaking, you as the patient, you as the member, have little or no liability. Your FEHB plan remains primary for your prescription drug coverage. There's a few things that are covered under Medicare Part B, like injections at a doctor's office, certain oral cancer drugs, immunosuppressive drugs, things like that, that are then covered under Medicare Part B. But most prescription medications are still going to be paid under your FEHB benefit. Now, if all those conditions are met, and you're retired, receiving your benefits from a retirement benefit, you're over age 65, Medicare A and B, but you've got an FEHB HMO, the Health Maintenance Organization plan. Take a close look at your benefits, because FEHB HMO enrollees may not need Medicare Part B. It's a different structure of benefits, and for the amount that you would pay into Part B, you may not recover the cost of that with the benefits that you receive. Take a close look, consider your personal situation. I'll also note, though, that Part B, down the line, if you find yourself in need of seeing a provider outside of your HMO network, Part B would pay for the costs involved with seeing those providers where your HMO may not have coverage. May also be that you want Part B if you decide to switch to a fee-for-service plan later on during a qualifying life event or open season. As I mentioned, some plans do have incentives. They want you to enroll in Medicare Part B. It helps spread the costs in different directions. So they may waive their copay, their coinsurance, their calendar year deductible. They may offer lower prescription drug copays. Some plans even have limited reimbursement for portions of Medicare Part B premiums. For some plans, this is just enroll in Part B, show us that you're enrolled in Part B, and we'll give you a little bit of money every month back in a health reimbursement or a Medicare reimbursement account. Others may want you to enroll in a Medicare Advantage plan offered under the umbrella structure of the FEHB plan. This is something that's really just come about in the last 4 years or so. So let's talk about those. FEHB plans, some of them, not all of them, some of them are now offering their own Medicare Advantage plans. These are optional plans. They are opt-in. And in many cases, you can opt in throughout the year, and you can even opt out of it during the year if you find that it's not right for you. They offer coverage that is equal to or better than the FEHB plan that serves as the main option. And I say better than because they offer value-added programs that in many cases we actually can't offer under the FEHB plan, but we can under the Medicare Advantage plan. Things like meal delivery after a hospital stay, non-emergency transportation to medical appointments, usually through like a ride-sharing partnership, coverage for telehealth, which is sometimes available under Medicare, but it's only authorized every time Congress does another funding authorization, so it's not guaranteed under original Medicare at this time. The Medicare Advantage plans under the FEHB offerings also can provide options and access to programs like Silver Sneakers, fitness benefits, the reduction in your Part B premium, as I mentioned. They also may be packaged together with their Part D plan to help save you on medication costs. They can also include coverage for things like hearing aids, vision, even higher limits for dental coverage. You do have to be enrolled in a Medicare Part A and Part B plans and pay the Part B premiums. You don't have to and you don't want to suspend your FEHB plan because you're going to remain enrolled in your FEHB plan and just opt into this extra option within that. This is not a commercial Medicare Advantage plan. This is an FEHB Medicare Advantage plan. But please also understand that Medicare rules apply. It is not the same as regular FEHB plan rules. There's maybe a different appeals process. You may actually be contacting a different call center if you have questions. And it may be different approval rules for you to get prior approval or require prior approval for certain procedures. As I mentioned, these plans are opt-in. You must choose to enroll, but plans do offer flexibility to do that throughout the year or change out of it during the year. Check specific plan information to see what rules they have. Now, in 2024, a number of plans launched Medicare prescription drug plans, and these are out there as with the name of Part D plans, Medicare prescription drug plans. Some of them even mention employer group waiver plans, or EGWP, sometimes pronounced EGWIP, and a number of plans launched these in 2024. There are major changes under Part D that begin in 2025. So let's talk just about what these prescription drug plans are and the employer group waiver plan. Essentially, for the first time in 2024, the OPM, the Office of Personnel Management, allowed group health plans in the FEHB to enroll members age 65 and older in a Part D plan and take advantage of lower costs that are available within those Part D plans. Some plans did and continue to do automatic enrollment of eligible members age 65 and older. You can opt out of this though, and if this applies to you as you're approaching your 65th birthday, the plan should let you know, hey, we're going to automatically enroll you. You've got a period in which to opt out, or you can opt out typically throughout the year. You may even have the option of opting back in throughout the year, having to wait for open season. Now, some plans have switched to an opt-in process for this. So if you want to take advantage of the savings as you become eligible, you've got to contact your plan to opt in. And plans have different rules about who is eligible. Sometimes it's just you have Medicare A. Sometimes they want you to have Medicare A and B for the automatic enrollment. It varies. So check your plan information, give them a call to understand it. Some plans have also structured the cost sharing, the copay and coinsurance amounts with their PDP to make it more appealing to members. You may have less out-of-pocket costs with these Part D plans, these Medicare prescription drug plans, than you would with the main carrier plan. Once again, though, I do want to note that CMS rules apply, including the possible IRMA premium add-on that we saw earlier in that second chart for Part D premiums. In this case, your FEHB plan would pay the main premium for the Part D plan, and you might be responsible for any amount above that based on your income, your modified adjusted gross income. These PDP plans, these PDP options, I should say, are only an enhancement to the prescription drug benefit. Members still receive all the same other benefits and programs in the regular plan design. This is just focused on prescription drugs. Again, some require that you opt out if you want to stay with the regular prescription benefits. Some allow you to come back in at any time, or you may have to wait till the next open season, but do the math. And I encourage you to do the math because there were some major changes in 2025. So even if this wasn't the right option for you in the past, the calculus may have changed based on maybe new drugs that you're taking or some of the new rules that are in place. Now, the Inflation Reduction Act, I'm referencing this here. There are certain parts of the Inflation Reduction Act that the change of administration that resulted in setting some of those aside. Largely the provisions around Medicare Part D, to my understanding, as of March 4th, 2025, are still moving forward. And it should mean additional cost savings for those who are enrolled in Part D plans. We'll see continuation of certain provisions that have been in place, including caps on insulin spending, $0 cost sharing on certain vaccines, and what at that time was known as $0 cost sharing in a catastrophic phase. Redesigned Medicare Part B starting in 2025. There is a cap on out-of-pocket costs for beneficiaries at $2,000 for Part D spend. But they've also changed how they calculate that out-of-pocket cost. Because if you have a rich benefit for your Part D plan, such as those found under most FEHB plans that are offering these, part of what your plan pays toward your prescription drug coverage, as well as your actual out-of-pocket costs, that copay you pay at the pharmacy, contribute to that $2,000 limit. And so for some people, if you're on a specialty medication or multiple brand medications, you may hit that $2,000 out-of-pocket early in the year and not have any out-of-pocket costs for the rest of the year for your medication. This will vary from person to person, but this could mean lower costs for you for your prescription drugs. The redesign has also removed the coverage gap stage and is ending the coverage gap discount program. There is a new manufacturer discount program that's in place. There's also a Medicare prescription payment program that will be in place. Um, and more details about that from your plan if you're interested. Now, beyond that, going into 2026 and so forth, Medicare will begin negotiating drug prices with certain drug manufacturers. It's starting with a small number of drugs, expanding each year beyond that. And we'll also be implementing drug manufacturer inflationary rebates, which are penalties, essentially if they increase the cost higher than inflation, and that will apply in Medicare. Here's what all that can mean, the redesign for 2025 in a chart. This is commercial Part D plans. Again, in the FEHB, if you're in a Part D plan, some of what your plan pays will contribute to that out-of-pocket cost. I'm not going into this in any detail. I want to cut to the bottom line, which is many people will find greater savings if they are enrolled in a Part D plan. Yes, it will vary. If you're only taking a couple generics and you're subject to the IRMA, maybe it doesn't make sense for you. But if you're within the lower income bands for IRMA, and if you're taking some higher cost medications, this may be right for you. Plans should have pricing tools on their website so you can see what the costs are out of pocket on their regular option prescription benefits and their PDP. All right, back to our main information and moving toward a wrap up. Couple things to note. Medicare does not provide coverage for spouses or children. There's no family or plus one enrollment. These are individual enrollments. However, if you have family members who are still covered under your FEHB and you're thinking Medicare may be right for you, that's okay. Your spouse, any children who are still eligible would still have their FEHB coverage as primary. Again, I point you back to section 9 of your FEHB brochure, excuse me. There's information there about coordination of benefits with Medicare. There's also a very informative primary payer chart that says if this, then that in terms of who pays first. If you're part of a tandem couple, so both of you are eligible for FEHB in your own right, Medicare Part B is an individual decision. FEHB is primary on the spouse who does not have Medicare. And if one spouse is still an active employee, the other's retiring, one is still an active employee, you might consider switching to a plus one or family enrollment with the active employee spouse covering the retired spouse as a dependent. Why? Because then you can delay that decision on Medicare Part B. You'd still have coverage based on current employment from that active employee spouse. And then once everybody retires, you lose that active employment coverage. You've got the special enrollment period. Again, you want to make sure you've got that extra form filled out. I do want to note that a plus one or a family premium under FEHB might be higher than two separate self-only plans, but might be less than paying Part B or paying an IRMA under Part B, which you might face if one of you is still employed. So consider this. If you're eligible for TRICARE for life and eligible for the FEHB, please note that Medicare A and B enrollment is required to maintain TRICARE eligibility and to use TRICARE for life. If you use TRICARE for life and continue your FEHB coverage, please note that typical payment is Medicare first, then your FEHB plan, and then TRICARE is the last payer in most situations. You can suspend your FEHB coverage. Again, not cancel it, but suspend it and just use Medicare and TRICARE for life without losing the right to return to FEHB during a future open season. But consider this. Before you suspend your FEHB coverage, think about, do you spend most of your time overseas? If so, I encourage you to take a look at the TRICARE website, find out how that coverage works, TRICARE for life works when you're overseas, and if there would actually be a premium involved, because Medicare is not going to pay anything when you're overseas. Then also think about, are there specific benefits that are covered by your FEHB plan, but that aren't covered by Medicare or TRICARE? Here are some resources for TRICARE. You can go to the TRICARE website. TRICARE for You is recommended. OPM has some information with their FAQs. There's also publications linked there from TRICARE that may be of interest to you, specifically about TRICARE and Medicare. Okay, final section before we wrap up. What happens if you don't enroll in Medicare Part B? Well, you have the same benefits as before. And there's some additional protections. Um, your liability is limited by law. And the law says that fee-for-service plans must limit their payments for inpatient hospital care and physician care to the payments that you would be entitled to if you had Medicare. So you continue to benefit from some of those limitations. Your Medicare participating and non-participating physicians and hospitals cannot bill you for more than they could bill if you had Medicare. Now, do they sometimes do that? Yes. If that happens, let your plan know. They have ways of working this with providers. You would still be responsible for your FEHB plan's deductible if they have one, co-insurance, co-payments, just like you have been as an active employee or prior to age 65. Please note this limitation does not apply to opt-out physicians, does not apply to outpatient hospital care, and does not apply to non-physician-based care. They're not covered by that law. But if you're going to an in-network provider with your health insurance network, then the discounts are still there that your insurance carrier has negotiated. So you still got protection. I'm going to give you a few final points to think about. First, right where we started, will you spend a great deal of time outside the US? If so, Medicare Part B may not be right for you. Second, what is your financial situation? Yes, maybe right upon retirement, right now, you might be concerned about that IRMA amount as a result of the modified adjusted gross income, the means testing, but consider the cost of healthcare. Consider what your income will be down the line. If you have Medicare and your FEHB, you are virtually 100% covered. Also, if you're interested in one of those Medicare Advantage plans, whether within the FEHB structure or if you're looking at the commercial plans, you've got to have Medicare Part B. To enroll in those Medicare Advantage plans. So just consider that, because I have just recently talked with someone who decided upon retirement Part B was not for them. And now I think they're regretting that decision 15 years down the line because they're finding that they need it. Their income has changed. Their medical situation in particular has changed. Come into that in just a minute. And they're wishing they sort of had that easy coordination with it. Because the other thing is that doctors and hospitals and so forth will assume that you have Medicare Part B when you come in. And it may take some additional explaining that no, you have coverage and it's not Medicare Advantage. It's not anything else. It's comprehensive coverage. But sometimes that can take some time to explain. I also want you to think about this. How is your health? I don't want to break this to you. I hope I'm not the first person to say this, but typically as we age, our health doesn't get better. We are more likely to seek medical care from more providers more often. So another thing to think about is, do your favorite doctors accept Medicare? I'll go back to what I talked about earlier. If you've got a favorite doctor, maybe it's a specialist, maybe it's your primary care provider, whatever, and they are an opt-out provider with Medicare. Maybe they're in network with your insurance, but they opted out. They're a private contract provider, can't bill anything to Medicare. That may help make your decision. You say, I'd rather stick with this doctor than pay the premiums into Medicare and still rely on my FEHB coverage. The other part there is, what is your tolerance for paperwork? If you're enrolled in Medicare Part B, you're going to participating and non-participating providers. They will typically bill Medicare Part B for you. Medicare will then send the information onto your FEHB plan through what's known as electronic crossover. Virtually no paperwork for you. Let me provide a few resources. OPM has information, Social Security Administration, Medicare, and I'm just sharing this as one example that AFSPA puts out for our plan. Most plans have web pages and even publications that are devoted to how their plan works with Medicare. Contact your plan for that information. Check their website. Finally, this video is part of the resources that you may wish to explore. We have a number of other videos on our YouTube page about Medicare. We also have done podcast series. We'll be publishing this also as a podcast, but we have some on Medicare, TRICARE, and the FEHB. That's almost 3 years old now, going back to 2022, but the information can still be very helpful to those who are trying to navigate the 3 different coverages and what's right for them. There's explanatory podcasts and videos about Medicare Advantage plans, and even an example of one of those prescription drug plans for the FSBP and Express Scripts. All of our episodes, there's a ton of other resources out there, can be found at afspa.org/podcast or on your favorite podcast app. Search for AFSPA Talks. As I mentioned, I welcome your questions. I'm happy to answer those, or my colleagues may be following up. You can email us at presentation@afspa.org. That's the best way to reach us. There's multiple people who check that inbox. We can make sure that we get you to the right person to answer your question. Otherwise, I want to say thank you very much for joining me for this presentation today. Whenever you're watching it, again, it is accurate as of March 4th, 2025. Typically, there aren't a lot of mid-year changes to Medicare, but if there are any, we will put up a new video, and we plan to have a new video up early part of 2026 with the updates, particularly to the premiums and the IRMA amounts. Thank you very much. Take care.